when you're working out there, you always consider what might happen if you get sick. And to be honest, I never thought that I would be evacuated. It didn't really cross my mind. And it was very early on when I spoke to people back in England, it was something that people were saying that was, a distinct possibility. And the thought was just it was such a comfort, the contrast between the prospect of staying in, sort of facing the disease in the West African setting, as opposed to coming back here and receiving the kind of care that I've experienced here. So when I was brought onto the runway and saw the plane waiting for me and the big team of Brits, it was just amazing. Just such a relief. I was given ZMapp. It's a long intravenous infusion, so it ran over more than 12 hours. And we don't know. There's no real way of telling what impact it had, but a day or so after having it, I was feeling a lot better, and the numbers in terms of my viral load were much improved. But we don't know whether that was down to the ZMapp or whether that was going to happen anyway. The work in Sierra Leone was a real privilege, really, to get to look after people when they're really suffering, and that's what being a nurse is all about. And so I feel that I've been able to do something that is what I've wanted to do sort of all along in my career. And so I'm more committed than ever, really, to following nursing.